Hi, I'm Philip Cosson from Shaderware Limited. It's January 2012. Today we're introducing the concept of virtual radiography to a whole new group of radiography educators. Imagine being able to make virtual radiographic exposures on a simple laptop computer in any location with complete safety and see the results instantly. Virtual radiography provides a whole new tool set for your radiography teaching. It uses the most innovative modern technology, but it's not untested. It's practical for larger class sizes and has proved useful for students. It is the most cost-effective way to enable student practice of radiographic skills. Already in its fourth major revision, it just keeps getting better and better. This podcast aims to describe the components of virtual radiography and outline the benefits it can bring to your school of radiography. As educators, we sometimes struggle to provide students with real-world clinical experience. There are many reasons for this. There can be too many students and not enough placements. The placements have become even busier, which can crowd the hesitant student out. Then there is the difficulty our mentors have in getting time with the students. Various changes have been put in place to address these issues, such as keeping student numbers down, pairing new students with final year students, and equipping students with some basic skills before they enter the placement. It is this last strategy that one of the elements of virtual radiography can help with. Projection VR provides a fully featured radiography room complete with table, tube, receptors, side markers and collimation controls, all within a computer on a desk. It is highly interactive and intuitive, with a point-and-click interface enabling the student or tutor to get right on with the learning. Multiple computers allow multiple X-ray rooms, and laptops allow portable X-ray rooms. In these pictures, 18 students at one of our customer sites are in the middle of a class wholly built around the use of Projection VR. The program leader tells us that implementing Projection VR alongside traditional skills lab tuition has allowed the individual students to have more experience before their first placement, but it's also reduced the timetable pressures on staff and skills lab. This worked because they reduced the hours each student spent in the skills lab from 12 to 9, but introduced a whole 9 additional hours of student time with Projection VR. Reducing the small groups saved 4 times 3 hours, i.e. 12 hours of staff and room time. 3 more than were added. As you can see from the pictures, the students are happy with both classes and they get different outcomes from each. They're not duplicating. In Projection VR, they focus on the terminology of equipment, positioning and projection. They learn the radiographic science they would have done by exposing phantoms in a live room. In fact, the module leader reports that several of the traditional lectures have actually been dropped, saving even more staff time, as the content is now practically covered within Projection VR sessions. This allows the skills lab time to become much more patient-focused, with students practicing manual handling skills, communication skills and infection control drills. Actors have even been employed as models for role play with the money that was saved. In another school, those experiments that are now conducted virtually are faster and the results are individual to the student. Each student has to plan, do and review their own exposures, where before students worked in groups. Typically, out of a group of students, 1 or 2 used to come to the fore and actually handle the equipment, where the others tabulated results and offered suggestions. Now, with the virtual radiography, the individual students are gaining the experience and checking their own understanding, and the lecturer can see who's struggling and who's not. Projection VR has a few other tricks up its sleeve. It has a console that allows selection of relevant studies and projections from a database of over 500. It allows students to save the virtual radiograph immediately to their hard drive for use in reports or assignments. It can be easily set up as a modality on a PACS system, providing DICOM data that meets international conformance standards, and it can operate as either a CR or DR X-ray room. The potential all this rich functionality provides you as an educator is vast. In your hands, given some time to explore, many possible areas of the curriculum can be enhanced. It's not just the novice students that need some time getting hands-on experience. There can be a dearth of certain specific examinations during the 9 to 5 day. For example, most patients for facial bone studies arrive late at night when the students are rarely present. They may be intoxicated and uncooperative, not the ideal first experience for even a final year student. With Projection VR, you could run a workshop allowing all final year students to attempt the less common projections. These future possibilities are exciting, but we realise that you will be busy and already have a lot of lessons prepared. This is why 14 outcome-driven and timed lesson plans covering 9 hours of lab time come pre-prepared with Projection VR. As a licensee, you will obtain permission to copy these and modify them as you see fit for your teaching. Virtual radiography has a further 2 components. While Projection VR is obviously the highlight for most, during its development we've been asked numerous times for some specific functionality that comes directly from a need in the classroom, but does not quite fit with the realistic interface of the room and the console. We were contacted by several educators across the world who were happily using Projection VR in simulation labs, but also had some lectures where they wanted to show radiographic mistakes, such as malrotation, misalignment and distortion. They were struggling to find the rejected images that exactly matched their requirements, and it was quite time-consuming to use Projection VR to create them. We created a simple interface that allows the effects of rotation, centering, angulation against the receptor and magnification to be shown in real time to a class of students in a lecture theatre. We call it Lecture VR. A different group of radiography educators were struggling with the physics curriculum. There is a general feeling that students find it difficult to connect the textbook physics with the practical application of setting technical factors on the console, such as tube voltage and tube charge, more often called KVP and MAS. Dropping the physics isn't an option, especially as radiation dose has recently become a big issue, with some recent scandals involving radiographers and the new worldwide Image Gently campaign. These educators approached us with a request for a more detailed console with more features. We thought about incorporating this with Projection VR, but decided it would add complication for the novice student and decided instead to write a separate program. We're glad we did, because this allowed us to model much more than one single piece of equipment. We call this new program Technic VR. It can show the X-ray output as a histogram of the photon energies in the spectrum in real time. It uses the most sophisticated maths and the most up-to-date data from the US National Institute of Science and Technology. This histogram is the sort of graph all students have seen in countless physics books, but this one is different. It moves. Simply by altering any of the technical factors, the effect can be seen. Filtration can be changed, tube voltage, tube charge, and more. For example, a mammography machine can be modelled to show the effect of rhodium or molybdenum as a target material. Time and tube current can be altered separately, and this allows the effect of these two factors on the life of the X-ray tube to be studied by looking at the filament current displayed. Another separate display can be provided to show how anode temperature is affected by long exposure times when using a stationary anode image intensifier in theatre, for example. So, these are the three components of virtual radiography: projection VR, lecture VR, and Technic VR.